Part of being a yoga practitioner is practicing through the ebbs and flow of life and whatever it brings you in each moment. And sometimes we are faced with something that's a bit of a challenge, maybe a physical challenge. Mia has a really great, well, it's not a great story, but she has a story that she's going to share with us and how it affected her practice.
So about 3.5 months ago, I was doing a Tough Mudder, which is a really fun sort of race type thing, obstacle race. And I tweaked my knee, and at the time I wasn't sure what was going on. I hadn't gotten a diagnosis on anything, but it was really large. It was about the size of a small baby's head. And I couldn't bend my knee, I couldn't put any weight on it, I couldn't do anything. At this point, I think what the doctors have told me is what's going on is they're saying that I have either a torn ACL or a torn meniscus or potentially both, but we don't have a firm diagnosis as of yet because we still haven't gone to get an MRI.
During a period like this, you want to keep the circulation going in the body. So we go back to the foundations of Ashtanga yoga, which is breath, which is vinyasa, which is bandha. The form may have to look a little bit different just because the body's not quite bending as it was. But even so, you just go through your practice, you go through your practice. You get support if you need support in certain places because things aren't bending right. Do you want to show us some of the progression that you that led you on this path of recovery?
Sure.
So Mia's going to go through her initial sun salute that she first did post-accident. So this is when you can imagine her leg was quite swollen. At home she used 2 logbooks. You could use anything. You could use a folded up blanket if it's big enough, whatever worked. If I was doing it, I might even prop up both, just so that they're even. We could play with that, do it both ways. Okay. Go ahead. You'll notice she's not putting much weight on her left leg at all. And during that time, that was how she was able to go through her sun salutation. And it can be a little bit awkward, which is normal. And it's amazing from a teacher perspective to sit and watch your students. Some students will need more input, they'll need help to figure the variations out, and some students won't. Mia was quite self-sufficient. She's been practicing a long time. And it's remarkable how over the course of these 3.5 months, now she can probably put full weight on her foot. And as a teacher, you're always noticing what's happening each day, each moment, because it keeps changing with an injury. As more circulation comes through, as the healing takes place, as it has, she's been able to bend her knee more. You won't see her using the books anymore when she's doing it. And now she's doing most of her practice. And it looks pretty normal, except for a few places where obviously the lack of full bending in her knee holds her back a bit. So for Mia, it was a fairly quick progression to standing sun salutes back to more of the normal sun salute as we know. She said it was probably a couple weeks. And again, there wasn't the possibility to bear much weight in her left knee still. So for Dhanurasana, it wasn't possible to reach this leg. I'm even guessing, I think it was even more like this if I remember. Sometimes what I would do is I would just give her extra support as she would lift up and do her back bend. So extra support in the pose is just like giving more foundation. It's like giving more bandha. So this is incredible. Mia has 2 books right now underneath, and without the books she wouldn't be able to hold this.
This is the most comfortable it's been the entire time.
Yeah.
And I still have 2 books underneath.
Yeah, but slowly one book will go away and then another book. Again, it's just a mindfulness journey. Being really aware, showing up, and seeing what happens each day. So Pinchamayurasana was interesting. Mia's been doing it for a long time, so there was no problem getting up. The idea of being inverted was really good for circulation and getting rid of some of the swelling that we were hoping. So to enhance the circulation, I think one thing we did was have her point and flex her feet. And And I'm pretty sure that I would just hold down like this, and she would flex and point, just to try to get more blood flow. It was all about blood flow and circulation. The inversion postures were really quite important that way. Headstand, shoulder stand. She does pinch her in her practice, so it's a perfect point posture to put in. It's been amazing and inspirational to watch Mia. She had such a great attitude during this whole process. I don't think I ever heard her complain at all. It was more a journey of curiosity and thinking outside the box, which sometimes in life we're faced with these challenges and we have to rise to them, and I'm sure she's learned a lot about her practice and the journey. I've learned a lot just from watching her and being inspired. But if something makes you stumble on your path when you're practicing, it doesn't have to be a setback. It can teach you a lot about the practice. And when you're in a yoga room, there are no limitations. There's just potential. And it's an opportunity to step out and go back to the basics, the breath, the vinyasa, the bandha, the drishti. And if you need help, ask for help. But listen to your body. It's a great journey.